Hello friends, today in this video we are going to discuss about nutritional deficiency. We divided the video into three parts. First part we will going to discuss the common vitamin malnutrition. Second part we will going to discuss the common mineral malnutrition, and in third part we will going to discuss what are the laboratory tests which we can perform to identify the common nutritional malnutrition. First is what are the common vitamin malnutrition. Basically in this video we are going to discuss about the deficiency disease of the vitamin. To start with, first thiamine or vitamin B1. As we all know, the vitamin B1 deficiency causes beriberi, and the symptoms are neuropathy, muscle weakness and wasting, cardiomegaly, edema, ophthalmoplegia and confabulation. Next is riboflavin. Riboflavin or vitamin B2 can cause magenta tongue as is shown in the picture. It can also cause angular stomatitis, seborrhea and cheilosis. Our dietary level per day is usually less than 0.6 milligram. Next is niacin or vitamin B4. It mainly causes pellagra when it is taken less than 9 equivalent per day, milliequivalent per day, and the symptoms of pellagra are pigmented rash of sun exposed area, bright red tongue, diarrhea, apathy, memory loss and disorientation. Next is vitamin B6. The daily intake of vitamin B6 is around 0.2 milligram, and the deficiency of it can cause seborrhea, glossitis, convulsion, neuropathy, depression, confusion and microcytic anemia. Next is folate deficiency. Folate deficiency typically causes megaloblastic anemia, and they are quite common in developing country. Megaloblastic anemia is anemia in which the RBC increases in size and thereby making it susceptible to hemolysis and thereby causing anemia. Apart from megaloblastic anemia, it can also cause atrophic glossitis, depression and increase in homocysteine level in blood. Next is vitamin B12 deficiency. Vitamin B12 deficiency also causes megaloblastic anemia with some important difference with the folate type of megaloblastic anemia, which is to be discussed in some later video. It can also cause loss of vibratory and position sense, abnormal gait, dementia, impotence, loss of bladder and bowel control, homocysteine, rise in blood and increase in methyl malonic acid in blood. Next is vitamin BC. The deficiency of vitamin C causes the famous deficiency disease, that is scurvy, which once terrorized all the European sailors in the 16th-17th century, where they usually suffer from scurvy and have a high mortality rate. What are the signs and symptoms of scurvy? Well, in scurvy the patient experiences petechia, ecchymosis, coiled hair, inflamed and bleeding gum, joint effusion, poor wound healing and fatigue. Next is vitamin A deficiency. Vitamin A deficiency is one of the leading cause of childhood blindness throughout the world, especially the developing countries like Africa. And what are the Signs and symptoms develop in vitamin A deficiency. They are xerophthalmia, night blindness, betot spot as shown in picture, the white spot over the cornea. Then the impaired embryonic development and immune dysfunction. Next is vitamin D deficiency. Vitamin D deficiency typically causes ricket, the skeletal deformation. As seen in the picture, the leg is showing bowing, the chest wall is showing abnormal protrusion. In closer look, we will also find the rachitic rosary, which is actually a elevation between the costochondral junction and the osteomalacia. The normal value of vitamin D is around 2 microgram. Next is vitamin E deficiency. In vitamin E deficiency, patient normally experience peripheral neuropathy, spinocerebellar ataxia, skeletal muscle atrophy, and retinopathy. The daily normal intake of vitamin E is trace amount, so it is not given here. And last is vitamin K deficiency, which, as we all know, elevated the prothrombin time and is one of the important marker of liver function test. And the daily requirement of vitamin K is around 10 microgram per day. Now next we come is the nutritional deficiency of mineral. Here we are going to say about the deficiency, but we will going to miss out the toxicity as they are out of the scope of this discussion. First is the boron. There is no biological function yet determined for boron, so we don't know about the boron deficiency syndrome. Next is calcium. In calcium, there is a reduced in bone mass, and also patients suffer from osteoporosis, a quite common disease among the postmenopausal women. Next is the copper deficiency. It causes anemia, growth retardation, defective keratinization, pigmentation of the hair, hypothermia, degenerative changes in aortic elastin, osteopenia, and mental retardation. Next is the chromium. This is quite producing sensation these days, that many pharmaceutical company have identified chromium as one of the main culprit in diabetes. It has been found that the deficiency of chromium is actually impairing the glucose tolerance of the tissues and thereby enhancing the type 2 diabetes mellitus. Next is the fluoride. Fluoride can cause dental caries. Especially they are found in the hilly area where the level of fluoride in water is reduced or nil, and in those cases the endemic dental caries are very interestingly observed. Next is the iodine deficiency. Iodine deficiency, as we all know, causes cretinism and goiter, especially the thyroid enlargement. And the marker for this is decrease in T4. Next is iron deficiency. Iron deficiency causes muscle abnormality, koilonychia as shown in the picture, deformed, that is the deformed nail. Then there will be anemia, decrease in work performance, impaired cognitive development, premature labor, and increase in perinatal maternal mortality. Next is manganese. Manganese deficiency causes impaired growth and skeletal development, reproduction, lipid and carbohydrate metabolism, and upper body rash. And next is the molybdenum, whose deficiency primarily causes neurological abnormality of varying origin. And last is the selenium. Selenium basically causes the cardiac abnormality such as cardiomyopathy, heart failure, and striated muscle degeneration. And next is phosphorus. Phosphorus causes all the problem of bone such as ricket, osteomalacia, proximal muscle weakness, rhabdomyolysis, paresthesia, ataxia, seizure, confusion, hemolysis, and acidosis. And last is the zinc. As we all know, zinc deficiency causes growth retardation, decrease in taste and smell, alopecia, dermatitis, diarrhea, immune dysfunction, failure to thrive, choroidal atrophy, and congenital malformation. So this concluded our second part, that is discussion on mineral deficiency. Now we are going to discuss about some common laboratory tests done to identify some common nutritional abnormality. First is serum albumin. Serum albumin is a test in which we assess the albumin level in serum, which is usually around between the 3.5 to 5.5 gram per deciliter. And if the range is below normal, then we know the protein is deficient in the body, and the disease such as kwashiorkor and marasmus can be diagnosed. Whereas if the level increases in the body, then it signifies several sorts of disease such as infection and other stress related disorder, burn and trauma, congestive heart failure, fluid overload, severe liver disease, nephrotic syndrome, zinc deficiency, and bacterial overgrowth. Next is total iron binding capacity. The normal range of total iron binding capacity is 240 to 450 gram per deciliter, and the deficiency or the decrease in total iron binding capacity signify there is a high level of iron, whereas the compromised protein whereas the increase in value of TIBC signify there is an iron deficiency anemia. Next is P time or prothrombin time. Prothrombin time is a marker of vitamin K deficiency. So the increase in prothrombin time, that is more than 15 seconds, signify vitamin K deficiency, whereas decrease in prothrombin time, that is less than 12 seconds, signify anticoagulant therapy or any severe liver disease. Last is serum creatinine level. Serum creatinine level, normal value is 0.6 to 1.6. Decrease in serum creatinine level signify decrease in muscle mass. Increase in creatinine level signify the renal failure, whereas now the urea nitrogen, which if the decrease signify increased level of catabolism and the decrease in protein intake. Similarly, the blood urea nitrogen, whose normal value is 8 to 23 milligram per dl, if is now less than 8, possibly indicate inadequate protein intake, whereas if it is in more than 23, it indicate severe liver disease, anabolic state, syndrome of inappropriate antidiuretic hormone, and renal failure, congestive heart failure. This concludes our discussion on malnutrition. Hopefully you have been benefited. Thank you.